Hi, everyone. Hi, everyone. This is Dr. Nazanin Homafar, OBGYN at UCSF. I am hosting today's second webinar for our Women's Health webinar series, COVID in Pregnancy, Mental Health in a Pandemic. We're just going to give everyone a minute to log in, and then we'll go ahead and get started. It's always exciting to see the participants starting to join. While we're waiting for people, we'll give it just another minute. While we're waiting for people to join, and before I start talking about the series, I would love to hear from our attendees how you heard about us. We are going to start a poll right now, and then also where are you in your pregnancy, so we can know how to best tailor our questions today. We'll give the poll another 15 seconds. It's amazing how slowly 45 seconds can go by sometimes. Okay, I'm closing out the poll here. So as of now, it looks like 40% of you who are listening, and we currently have about 85 attendees, 40% of you are in your third trimester. We have 14% of you in your first trimester, 36% in the second trimester. We're so excited to have our postpartum patients joining as well. There's 3 of you right now, and 3 of you are thinking about trying to get pregnant. So hopefully this session will help you. And most of you heard about us through MyChart, which we're finding to be the most effective way to reach you. So hopefully you won't feel like we're bombarding you with messages, but we'll definitely keep that in mind to continue using MyChart to reach you and let you know about these series. So before we get started on our topic today, I wanted to give you all some updates and let you know about this session. So the Women's Health webinar series was designed specifically for our patients during the COVID pandemic in order to give you a sense of what we're doing behind the scenes to address any concerns you have. Last week's session, prenatal care at UCSF, was a highlight about inpatient and outpatient care, what to expect from the pediatric side. We had over 400 attendees, which was amazing. And for those of you who are joining us today who might have been on that call or who are joining us for the first time, you can see a recording of that event and frequently asked questions that came from our discussions on our Women's Health Resource Center webinar tab. So you can search in Google Women's Health Resource, look for the .edu page, and then scroll down in the webinar series. You can watch that recording. This recording today, this webinar today is also being recorded and will be, give us a few days before we get it posted. We're so excited to be able to offer this series and another series to you called Zooming Through Pregnancy to Parenthood. That one is hosted by our amazing midwives and really focuses on different prenatal education topics that we might not otherwise be able to get to you during this time when we have limited capacity to meet in group settings. Today's webinar, we have 3 wonderful panelists, mental health in a pandemic. I think hopefully, I mean, I might be speaking to all of us here, but really like our lives have been thrown for a loop in light of everything that's happened. Personally, I don't think I've gotten a good night's rest ever since we went into shelter in place. And we wanted to make sure that this webinar helped perhaps normalize some of the feelings that you're having, explain some of the feelings you're having, talk to you about the resources that are available at UCSF, and also give you some tools for advancing in the pregnancy, knowing what you can do, and knowing what's safe to do in pregnancy. A few ground rules before we get started. This webinar, as I mentioned, is going to be recorded. You'll hear from all of our panelists. Please, you're welcome to send us questions throughout the webinar, but just know that we're going to try and aggregate them. We're leaving 15 to 20 minutes at the end for us to be able to answer your questions. If we don't get to your question during the webinar, we will be looking at it and offer it in the FAQ portion that will be posted within a week. So without further ado, I'd love to introduce our speakers today. If you can wave when I say your name. We have Dr. Margot Pumar, who's one of our psychiatrists at UCSF. She's also the Associate Medical Director for Integration and Collaborative Care at the UCSF Medical Center and has a particular interest in women's health. We have Dr. Amanda Yeadon-Massey, who is a perinatologist. I've never had a field that has had so many different ways to call them. So you can call her a perinatologist, a maternal fetal medicine, or a high-risk doctor. She's also part of the perinatal wellness team and has a particular interest in women's mental health. Dr. Yeadon-Massey, can you give us a wave so we know which one is you? There we go. And then we also have Melissa Whippo. She's one of our amazing social workers who's housed in the Department of Pediatric Social Work. Some of you may have met with her in the outpatient setting. She also leads a lot of our group education classes, specifically the Afterglow program. I'll let her say wave hello as well. Wonderful. And for some of our patients who might be Spanish speaking, I think hopefully you've already figured out, but we do have an interpreter who will allow you to listen to this session in Spanish. So before we get started, I just wanted to give, to give you all another poll. This poll is just to get a sense of what your feelings have been since shelter in place has gone into effect. So Brooke Peterson, who's helping me run this webinar, is going to put out that poll now. So since shelter in place, have any of these feelings resonated with you? We'll give you 30 seconds to reply. Select as many that seem relevant to you. Okay, we'll close the poll now. I'm not totally surprised, but I do think, I don't know, it's validating to me that what I've been feeling isn't something that's just unique to myself. 53% of you report feeling anxious. About 12% of you say that you're having trouble with sleeplessness. 22% of you feel stressed. I'm very excited for the 3% of you that say you're happy. I'd love to know what I could be doing in my life. But let's get started with Dr. Pumar first. Dr. Pumar, in light of these poll findings, I wanted to get a sense from you, what are the most common themes in the patient interactions that you're having at this time?
Yeah, hello everyone. It's really great to be with you. So you're asking what types of things my patients are talking to me about?
Yeah, given that we have like 50% of people saying that they're anxious today.
They're anxious. Yeah, I think
that as well.
Are most concerned about like their health primarily. Pregnancy and postpartum is just an incredibly vulnerable time physically. And so I think normal pregnancy is surrounded by worrying about health and the health of one's baby. And so I'm hearing that even more so. And then I think things that maybe people who aren't pregnant or postpartum feel a little bit more comfortable going outside and getting a walk and getting some exercise. I'm hearing that my pregnant patients just don't feel safe to do that. They feel really worried about being exposed in some way and being sick, or having their baby get sick. And then I think there's just also the other stressors of many of the moms here probably already have children, and being at home with your children all day is really stressful. But also, many kids are not getting kind of the normal things that they would get. They don't get to see their grandparents, and they don't get to be in their preschools or in their elementary schools and see their friends. And so that's really stressful for parents as well. And then I think a lot of financial concerns too.
Absolutely. And I know you had prepared some slides that you had wanted to share with us. Do you think, I have a few questions, and I wonder if we might be able to share your slides and then talk about some of the...
Yeah, happy to take some questions as well.
I'll let you share your screen.
Okay. Yeah, so you already know we're here to talk about pregnancy during this really difficult time. I don't know about you, but I have never been through a global pandemic before. And it's pretty stressful. And I think for many ways, there's particular stresses for pregnant women. So a day in the life of being pregnant or postpartum, or thinking about it, is really stressful. We think about the chaos at home with everybody being all in the same place. I read this morning that unemployment was up to 22 million in the last few weeks, which is a number it's honestly just hard for me to even grasp. Being at home means that there's a lot of risks, like intimate personal violence. And then, I'm sure most of you at some point saw the headlines from the New York Post about Columbia Presbyterian had initially banned women's partners from coming in delivery. I know that led to a lot of concerns and questions. And then there's all the other stressors related to it, and just sort of like, how do you get by, and how do you make sure you have enough toilet paper and all those things. I just look at this slide and think, yep, this is life, this is intense. And with that comes just really a whole array of emotional experiences. I talked a little bit about what patients are saying, but I think on some level, even the healthiest people are struggling with many of these feelings. The anxiety, low mood at times, boredom, frustration, irritability, as well as just being, exhausted, because like Dr. Hamafar said, it's hard to get a good night's sleep. A lot of patients telling me, especially in the afternoon and getting earlier and earlier, they just feel just completely on edge. And, if they've used substances in the past, they think about it, or using alcohol or marijuana. And then sometimes, when things are really difficult and challenging, people can even have thoughts that are dangerous. Did you have a question?
Oh no, I was gonna say, today was the first day that I can motivate myself to put on makeup. It is perfect. So I've been feeling a few of those things.
Yeah, no, absolutely. I actually, the same thing happened to me, Dr. Hamafar. I also put on makeup for like the first time in weeks. And I had an early Zoom appointment with someone who's been seeing me daily, and was like, wow, what is going on? I was like, I'm trying to practice what I preach. So I washed my hair 2 days in a row. This is like unheard of.
I wasn't going to mention that, but yeah, I wash my hair too.
That's mostly for you guys who are out there listening. So I think, for me and for many people, our routines are just completely thrown. I mean, this actually comes from Maslow's hierarchy of needs, to give him credit. And so I think almost every area of our lives, and how we normally, without even thinking about it, organize our lives to promote our own well-being, is thrown. So my big accomplishment for the week was brushing my teeth every day before noon. It's been a goal, and it's been a struggle, because my normal cue for when I do all those things has been totally thrown. And so I've had to like figure out totally new cues. And sometimes I'm able to do them and sometimes I'm not. But doing like planning your basic routine and having to kind of redo like, okay, well, I'm not doing anything. When do I have lunch? I'm not, I'm not going anywhere. Is it worth showering? And, what I would say is human beings, it's actually really important to do these healthy basic things and help us to feel human. And then we're thinking about safety. And so, one of that is just kind of knowing all the things that you should know about the virus and what are risks and what really aren't risks. And then in terms of kind of emotional safety, we know there's lots of research that says that it's important to limit the news. It raises stress for most people. And so really just have a couple of places where you get trusted, simple, objective information about what's happening with COVID is, I think, more than enough. And then needing to learn how to experience belonging and love and connection. I was speaking with an old neighbor the other day who does not have an iPhone or any kind of smartphone and was like, I figured out Zoom. I'd really like to see your kids. And I was like, let's do it. And then, just managing your own kind of sense of self. It's important to, have a good plan for self-care. Like I said, none of us have done this before. This is taxing us in every possible way. And I'm not usually a huge proponent of like, everybody get an app. But I think if you haven't developed a good skill for meditation or deep breathing or de-stressing, I think it's such an excellent way of working that into your schedule. And finally, when you kind of feel like you're getting it, or even before, really kind of reaching out to others who you think might be vulnerable or needing some connection, it can really help give you a sense of purpose, in the midst of this difficult time. So here's just a couple of examples of apps. I'm sure many of you have heard of them. So CBTI for sleep, Headspace, Calm, Daylight, Sleepio. These are all good ones. I actually highly recommend that you check out this website, the psychiatry.ucsf.edu, coronavirus. If you don't write this down and you forget it later, all you need to do is Google psychiatry UCSF, and it's on the front page. You cannot miss it. And it has so many wonderful self-directed ways to kind of support your wellness, as well as links to higher levels of care if that's what you're looking for. So I can't recommend it enough. It's just a great place to kind of know where stuff is and start looking at it. And then there's obviously other things like therapy and medication and other resources.
I was just going to say, Dr. Kumar, we will be in the frequently asked questions worksheet that we post along with the recorded webinar. We'll make sure to include these resources for our patients.
Yeah, super helpful. Great. And then just lastly, Dr. Hamafar actually sent this to me. I think it's quite a busy visual, but I've been talking about it with so many different groups, physicians, staff, patients. The idea that actually, I know this time is incredibly difficult, but human beings are also amazingly resilient, and sometimes in the most difficult times, we are able to kind of rise above and do more amazing, beautiful things than we ever thought was possible. And so I just kind of put out this question, who do you want to be during COVID-19? I had a medical director say, people spend thousands and thousands of dollars to go be by themselves on a Buddhist retreat, and we get to do it for free. So, take some of these ideas and really think like, this might be a good time to work on, X, Y, and Z. Give yourself a project, help you to feel purposeful. And yeah, I think this time is crazy, but I think personally, we also have the opportunity to really grow in the midst of it.
Thank you, Dr. Kumar. I think that was really helpful, and that answered some of the questions I was going to ask you about where, what resources might be available to patients. I think one thing you highlighted some of the feelings we might be having on your second slide, but what signs should our patients be looking out for to know that they should try and speak with someone?
Yeah, so that's such a great question, and I can answer it in a couple of different ways. Um, you know, so one thing is, you will be having check-ins, throughout your pregnancy with your providers. And I think it's helpful just to touch base with them and just be really honest, the times that you're struggling, so that you can have someone kind of objective hear what you're saying and help you figure that out. I think, but just on a personal level, I think if there's moments that turn into days that just you're thinking to yourself, this is too hard, or I just can't do this, and that's feeling quite consistent, then I think that's a time to get help. So as an example, you know, uh, at night I sit down with my kids and we try and go through the SFUSD online school, and I really have a hard time. Like, I think they have more logins than I do, and just getting onto the pages that they need to use, like, puts me over the edge. And I just feel so incredibly stressed. But at some point we get through it and then I'm able to calm down. But I think if feelings like that, of just like overwhelm and frustration, continue on and on, that's too much. Like, that's suffering that you don't want to have to experience. I also think other just really objective symptoms, like if you're continuously having problems sleeping, eating, you just can't stop yourself from worrying, like the thoughts just won't turn off, and it's starting to really get in the way of your life and your ability to do any work or tasks or get along with your family. Those are also really good times. When it's really starting to interfere or cause you really significant distress, I think is a good time to reach out.
Thank you. And Dr. Amanda Eden-Massey is going to go through some of those as well, and how it might pertain to our prenatal patients. And before we move on to Dr. Eden-Massey, I guess the other thing, you brought it up in one of your slides, but what else should we be thinking about? We've heard about people who are affected by domestic violence at home, or potentially people who've had thoughts about suicide in the past. Like, what should we be thinking about, and what can we do for those patients?
Yeah, so I would address both of those a little bit differently. I think both, it's important to have information. So for suicide, there's always suicide hotlines, and I think those will be posted in the webinar. Again, you can also go to the psychiatry webpage. You can also just Google suicide prevention, and there's a lot of different hotlines that you can call 24 hours a day. And then obviously that's a good cue to seek help, and to come to us in our clinic, and we can provide you some care and get you pointed in the right direction. For interpersonal violence in the time of sheltering in place, this is an especially difficult challenge, one that concerns me a great deal, because oftentimes someone's privacy can't be ensured, and so there.
I think we lost you for a second.
I can hop on if you want.
Yeah,
We'll
let's
get
have
Margo
you.
back.
Sure. Dr. Eden-Massey, if you can potentially speak to the intimate partner violence and what patients can do.
Yeah, I mean, I think honestly, Melissa is probably the best versed in this topic, but I think essentially what Margo was getting at is that this is an enormous issue right now. It's an issue that's invisible even without a pandemic, and it's an issue that's even more problematic as people who had been perhaps living in a shelter situation go back home because they are scared to live in a group home. And I see we have Dr. Pumar back, but just I think the issue is becoming more problematic and more prevalent, and as stress goes up, intimate partner violence goes up. And we will share some resources for where to go to get help for folks who are experiencing that.
I think the other thing just to say, to normalize it, there's so much shame that's associated with that, and self-blaming and rationalizing. I looked at a statistic yesterday from Futures Without Violence that 1 in 4 women have experienced interpersonal violence in some way. That's a huge amount. That's not like, oh, that's just a couple people dealing with that, I'm the only one. That's quite frequent. And so I say that, although it's a horrible statistic, to say, you know, you're really not alone, and there are so many people that want to help you right now.
Thank you, Dr. Kumar, and thank you for your time. I know you're very busy everyone's very busy these days. Dr. Eden Massey, I wanted to talk to you about how we should think about accessing care and what resources are available to specifically our prenatal patients at this time.
Absolutely. So, I mean, I think every patient who comes to care with us should be aware that we, as a practice, screen all women for anxiety and depression because it is so incredibly common. So even in the absence of a pandemic, we know that somewhere around 1 in 7 women will have anxiety or depression either prior to pregnancy, in pregnancy, or postpartum. And so this is something that we formally screen folks for when they come to care and in the postpartum period. And so we try and identify women for whom this either has been an issue or is currently an issue and connect them to resources. For all of our patients, we can provide educational materials. We can talk about the different ways in which anxiety and depression manifest. So, you know, when I say anxiety, it may make me think of and feel something very different than somebody else who's on this call. So some really common things are insomnia, irritability, anger, and the way in which our feelings manifest is often different. So some education around what those things can look like. Within our clinic, we have Melissa Whippo, who is one of our incredible social workers, who also works with Sharon Chi, another one of our social workers. And together they provide therapy services and referrals into the community for women who need more than what we can provide. We also have Dr. Pumar and Dr. Mangurian, who are our embedded psychiatrists within the clinic, to help us care for women for whom just one-on-one therapy and medication, either with their OB provider, is not enough. So, you know, I am personally comfortable prescribing for patients, and there are certain circumstances in which we always want to involve a psychiatrist. So we have all of those within the OB clinic. And then within UCSF as a whole, we are connected to the Langley Porter Psychiatric Institute, and they have a whole breadth of services for our moms who need more intensive support and treatment. So there are the women's mental health services, and then there's something that until I got really interested in the mental health space in pregnancy, I didn't know about, but there are these 2 different things called either an intensive outpatient program or a partial hospitalization program, which are really somewhere between being in the hospital and being in the world. And it's sort of this bridge between those 2 places for people who need more support than they can get in just, you know, the weekly therapy session, but who don't really need to be in the hospital. Mm-hmm. And in rare cases, we have people who are suffering so much and who need such intensive support and treatment that admission to the hospital is the best course of treatment. And all of those are available to our patients.
I think it's really important to highlight the breadth of services that are available to our patients, because I think it's easy to just, you know about therapy and perhaps medications, but to know that there's so much more out there, and that talking to a psychiatrist or talking to a social worker or your own OB or MFM about your feelings doesn't mean that we're going to, that there's an algorithm that you have to follow, you know, every time. Your care is very individualized, and I think it's important to know sometimes for some people it might require an inpatient admission, and for others there's some outpatient services, and that there's so much in between that as well. So thank you for highlighting that. How does stress, I think one of the questions I often get as a generalist when I see prenatal patients are how does stress, depression, or anxiety affect a pregnancy?
Yeah, it's an important question, and I think it's a really hard one to answer, because when you tell somebody who is stressed out that stress has negative impacts on pregnancy, that makes them feel stressed. And I remember when I was a trainee and I was pregnant, I was incredibly stressed out, and I had all of this stress and guilt about how my stress was going to negatively impact my pregnancy. So yes, stress does have a negative impact on pregnancy for moms and babies. And we have a lot of ways in which we can help you manage stress, and we can mitigate some of those risks. So I think the most important thing to remember is that while having anxiety, depression, stress in pregnancy can have negative impacts, it doesn't have to. And that we want to help you identify those issues so that we can connect you to get help. And, we formally screen on intake and postpartum. And like Dr. Kumar said, we want you to be really upfront with us as your providers if you're having feelings that you want help with, so that we can connect you to those resources.
So let's say someone is going to start taking medications because it's appropriate for them. Can you tell us if medications for 1, depression, 2, anxiety are safe to take in pregnancy? And if so, which ones?
Sure. So there are absolutely very safe medication options that can be taken in pregnancy for both anxiety and depression. And often those medications are the same, but perhaps in different doses and in different combinations of therapy and other self-care regimens. So our first line medications are typically an SSRI, or a selective serotonin reuptake inhibitor. And often we'll see women who have in the past been on an SSRI who went off because they were concerned about medication exposure in pregnancy. So if a woman has been on a medication prior to pregnancy and that medication worked for her, I will often actually go to that medication instead of one of our other SSRIs that have better data, because there are very few medications in pregnancy that are absolutely contraindicated or absolutely not safe to use. So the vast majority of these medications have a very good safety profile. And we always talk about this idea of risk. So yes, medication exposure has a risk, and being anxious and depressed is associated with risk. And I always think of it as we are helping mama and baby when we go to medication if it is indicated. And if we don't and mom is suffering, nobody is well. And I consider that to be potentially more risk than pursuing medication.
Okay, that's great to know. And then, because I get this question, and I have patients who have decided to take the jump and either continue the medications they were on or start them for the first time. And then they go to their pharmacist, and the pharmacist makes a comment that perhaps the medication's not safe for them to take, or that they should talk about it with their provider. And I think, I'm happy to field those questions, but it's really hard when people are getting mixed messages.
Yeah. So that happens a lot, unfortunately. I will actually sometimes warn my patients that they may get that feedback from the pharmacy, and to, call me if they have additional questions after, and try to sort of preempt some of those issues as they come up. But it is hard. And I think there's a really wonderful website that we can put in the FAQs called Mother to Baby, which is run out of the University of California, San Diego. It's a toxicology website, and they have patient-facing and provider-facing information. And during business hours, they will actually live chat with you about all medications and any exposures. They have everything from antipsychotics to spray tanning. So they have these amazing handouts on really any exposure. I had a patient once ask me if she could spray tan, and I said, I don't know, I'm going to look at Mother to Baby. So you can get like really good concrete information. And often that information says, hey, we don't really know about what this is going to do in pregnancy, and we know it's probably fine.
Okay, thank you. And then, so just to, I know the answer to this, but I just want our audience to hear, are these medications safe to take while breastfeeding?
They are. There are certain circumstances in which we are a little bit more careful than others, and there are certain medications that have better or worse safety profiles with breastfeeding. But in a term baby who doesn't have any other issues, the vast majority of medications are very safe in breastfeeding. And even the medications that have some concerns, we usually just talk about, what things to look out for and go over the safety profile. And if you're starting a new medication in pregnancy, we always, as obstetricians, think about, okay, this is a mom who will want to breastfeed. Is this medication safe in breastfeeding? And I encourage every patient who ever starts a medication to ask these questions, because it's important. We are a team with you, and we want to hear your questions, and we want you to ask us these questions so we can talk about it.
Absolutely. Thank you. Dr. Massey, I know you're also on service right now, and you had to hide away for a bit. So thank you so much. That was really helpful. And just a reminder, I forgot to say this at the beginning. The purposes of these webinars is really to complement and supplement the information that you're already getting. So in no way are we going to be able to answer all of the questions you might have about certain therapies or medications at this time. Please know that we just want to give you an overview. So if you have any questions, we're going to try and answer, obviously, in a few minutes in a Q&A, but these are questions to have with your healthcare providers or conversation.
Can I just add to one thing to what Amanda said?
Yeah.
I think it's helpful that that everyone got to hear this from Amanda, because I think people often think psychiatrists like, oh, they're going to push drugs on me. So I do have to say, generally, in pregnancy and postpartum, I will, and just as practice, pills don't necessarily fix everything. There's often things that we can be doing better. And so in this perinatal period, more than like any other time, I will also strongly encourage our patients to kind of use other non-medication types of interventions to improve their mood and help them to not be so anxious. And so, I rely heavily on the social workers like Melissa Whippo, who is in the clinic, to provide them with some other techniques and even refer them to therapy when that's needed.
Thank you. And Dr. Kumar, that was a great segue to Melissa Whippo. Thank you. I couldn't have said it better myself. Melissa, I'd love to hear from you now to see, most of our patients will usually see you at Mission Bay. Sharon G., our other social worker, is usually housed between Mission Bay and Mount Zion. Can you tell us how you're seeing patients talk about their mental health when you're checking in with them?
Yeah, and I really appreciate everything that's been said so far by Dr. Pumar and Dr. Massey, and by you, Dr. Hamafar. I do think that the thing we're seeing the most increase in is anxiety. And anxiety for so many pregnant women and new moms is about not being able to trust, whether it's trusting our own instincts or trusting maybe what we believe to be true when we're in a crisis like we've never been in before. It's hard to know what's true, what to listen to, what to trust. And so to have a care team of providers that hopefully patients can trust is really important. And that's why I think it's also really helpful to come together like this. The other thing that we've already mentioned is the increase in intimate partner violence. And there are some good resources. The hotline that Dr. Pumar included, I think, is helpful. And also to the point about, maybe stretching ourselves during this time or trying to do things. I have put together a very small volunteer group of people who we're kind of doing a needs assessment, looking at all the existing resources in the Bay Area for intimate partner violence and seeing what else is needed. Do they need more volunteers on the phones? Do they need more financial resources? And then hopefully we'll put something together to share what else is needed if there are people at home who have time who would like to help, because I think more than ever, the resources that exist for intimate partner violence are not as accessible. So women are more trapped in their homes. And I know in other countries, they've developed systems where women can go into a pharmacy and have a safe word to say to the pharmacist.
Yeah.
So there's lots of things that we could potentially explore and look into. But I think, you know, what happens with anxiety and also with intimate partner violence is the nervous system gets really activated. And to the point about what both the previous speaker said about, we don't want patients to feel bad on top of feeling bad. So if you're feeling stressed and if you're feeling anxious, really inviting that practice of self-compassion in, because when the nervous system gets activated, which in some extreme cases can lead to a woman having a panic attack, certainly medication is helpful, but having some kind of practice of learning how to regulate the nervous system, even in the midst of a crisis, can be really helpful. From the basic things that have been outlined already, like self-care practices, to meditation practices and yoga, and certainly therapy and medication. And the good news, bad news of the crisis is that there's so many services being offered virtually right now, which I think is actually helpful, particularly for our postpartum patients, because a lot of women with new babies feel kind of stuck at home anyway. So now there's no pressure on them to go out. And yet it's such an isolating time. So at least being able to connect with other women virtually is really helpful. And we have at UCSF, we've added another Afterglow postpartum support group that starts next week. So we have a group happening right now, and then we'll have another group starting next week, and then it'll be ongoing. And that's all that information is on the Women's Health Resource Center site.
Can you, Melissa, you mentioned Afterglow. I'd love for you to kind of explain it, but can you tell us about the group models of care or individual services that are available to our patients during this time?
Sure. So there's and the website is almost finished. It's still under construction, but patients can access it. So if they just search Perinatal Wellness Program and UCSF, the page will come up about the services that we offer to all of our OB patients. And this can even be preconception for our patients who are going through fertility treatment. There is a psychologist, Lori Posh, and another psychologist, I'm forgetting her name, in the fertility clinic. But they can also access our services in the Perinatal Wellness Program, which would be an initial assessment with either myself or with Sharon G, where we can, you know, work together, because everybody's situation is different. What are the resources needed and what are the clinical interventions that are needed? So if somebody really seems to demonstrate a need for a more intensive program, and if their insurance will allow, they could get some of the more intensive services at Langley Porter. Or for some people, the intensive one-on-one psychotherapy feels like too much, so we might recommend a support group, whether it's a group in the community or our Afterglow program. Or I know there's a new support group that's going to be piloted that I think you were going to talk about. And there are some wonderful group supports in the community. But the group therapy, I think, at the very least, can just help women feel that they're not alone going through what they're going through, that there's lots of other women like them. I mean, Dr. Yaten Massey mentioned the numbers are like 1 in 7 women, which is about 20% of women experience some of these issues during pregnancy in the postpartum setting. And those are our reported numbers. So we assume that the numbers are actually much higher. But the group setting of support is a really helpful way to destigmatize some of this. So the sessions with Sharon and myself are unlimited throughout the pregnancy and the postpartum setting. The follow-up appointments are 30 minutes, so we can't do in-depth psychotherapy, but for some people who just need a regular check-in, that can be enough. That 30-minute appointment can be enough. And then we can refer patients who have more significant medication needs to Dr. Pumar and Dr. Manchurian. But like Dr. Yaten Massey said, a lot of times, if it's clear that the patient is comfortable with an SSRI, their OB provider can probably work with them about that.
Thank you for highlighting these, Melissa. And I know I was hoping you would be able to take us through a mindfulness exercise. But before we go into that, I do think something that I talk to my postpartum patients with, or for my patients in their 3rd trimester as they're getting ready to, you know, I'm going to see them on the other side when they have their baby, is to create these virtual support groups even before COVID amongst your friends. I
Mhm.
think some of the best support I had when I was in the postpartum period was texting with my friends in the middle of the night who were
Yeah.
going through the same thing on the East Coast or maybe even in San Francisco. And I developed these friendships that like with people that I was close to, but it really bonded us in a different way. So in this time, I think even though we have shelter in place, even though our interactions with people have been severely limited, and maybe we have Zoom fatigue and like can't do any more, but find ways to reach out to your community. And you
Mhm.
don't have to use everything. Like I had a girlfriend who I would just tell things that I was stressed about too. I didn't have to spend the time telling her all the good things, but it was nice to have that outlet. So looking externally to your friends and seeing or family and seeing how they can support you too, I think is just something to keep in mind. And
Mhm.
on that note, I do want us to be able to take something from this session today about how we can introduce mindfulness into our everyday lives. Melissa, would you be able to take us through like a 3 to 5 minute exercise?
Yeah, I'd be happy to. And I wanted to mention another resource that's free, actually. There is it's a meditation practice called Yoga Nidra, which is a little bit different from what we're going to do. The Yoga Nidra is more of you're lying down and resting. It's almost like a sleep, a guided sleep, but you're not completely asleep. And there is a yoga teacher in Southern California. Her name's Tracy Stanley, and her website is tracyyoga.com. And she is offering a free Yoga Nidra recording. So I think for a lot of our patients who, and she is a woman of color also, and I think for a lot of our patients to whom some of these practices might feel weird or strange, it's really helpful to have free resources. There's a lot on YouTube, in addition to all of the apps. But this practice that I'll take us through is just a very simple practice. And I do have some on my website also. It's just my name, melissawhippo.com, that are specific for pregnancy and postpartum, and those are all free as well. And some people don't feel comfortable closing their eyes. So if you don't want to close your eyes, you don't have to. I just recommend picking a place for your eyes to rest so the eyes are not moving around. But if you can let your eyes close, that's great. And we work with the breath. The breath is our best mindfulness tool, always available. And for our pregnant women, very helpful to focus on the breath, very helpful for your baby. And it helps us slow down the nervous system, so helpful for anxiety. So focusing just on the exhale for a few moments. And you'll notice, if you can really tune in to what's happening in your body, that every time you exhale, the body has a natural settling that happens. So you can really notice the heaviness in your body every time you exhale. And if you're sitting in a chair, you could really feel your feet on the floor. You can feel the support of the chair underneath you, or if you're sitting on the floor, you can feel the support of the floor underneath you. And just noticing all those points of contact in your body every time you exhale. And if there are places in your body where you're holding tension, I think for a lot of women, it's in our jaw or our neck and shoulders. There can be kind of a dropping down and a settling every time you exhale. And then working with the inhale. So every time we inhale, there's a filling up, kind of an expansive feeling in the body, whether that's in the belly or at the chest, or even lengthening. The spine can lengthen, the back of the neck can lengthen. So every time we inhale, there's an opening, a lengthening, or an expanding. And the thoughts will certainly come and go. And some of the thoughts might be persistent. A lot of them are about planning, right? What's next? What am I going to do next? What's on my list? Or ruminating, thinking about the past, or shoulda, coulda, woulda. So if we can Just acknowledge the thoughts when they come in. And then see if we can come back to the breath. Just that very simple practice of exhaling, allowing the body to settle. Inhaling, allowing the body to expand. Just working with the breath and the physical sensations in the body. And acknowledging when the thoughts come in. There they are, there they go. It's a way of practicing some compassion so that we learn how to meet whatever is present in our bodies without any judgment, without making ourselves feel worse about it, without even trying to change it, just noticing. And we'll just take a few more breaths like that. Inhaling and exhaling to notice what's present in the body, what sensations are present, what emotions might arise. And as we start to bring the practice, this short practice to a close, we might even retain some of that ability to pay attention, because the body is always giving us information. The body has a lot of wisdom. So if we can learn how to trust what we feel, what we notice, without having a lot of reactions about it, that can be a very helpful practice to turn to in a moment that feels really stressful. And then we can connect with our more rational parts if we're not caught in the loop of our nervous system getting activated and reacting to that. So as we bring the meditation to a close, the eyes can open. I like to wiggle my fingers and toes just to let my body know that we're making a transition into a more outward focus.
Melissa, you've been a calming presence for me ever since I was a resident in 2015. And I appreciate you sharing a few minutes of how to stay calm through all of this. And I appreciate all of you who have come and helped us today. I wanted to get to the questions that patients had. And be mindful of the time. We are going to be ending around 1 p.m. And before I go to the questions, I did want to say the support group that you had mentioned is going to be the COVID support group for 10 UCSF pregnant moms that'll start May 1st. There will be an announcement going out. Look for it on the Women's Health Resource Center. And we will also have the more comprehensive list of resources for our patients on the FAQs in the next few days. One of our listeners had asked, are there psychologists within the UCSF network who specialize in perinatal and postnatal CBT? If so, where can we find their information? Dr. Kumar or Dr. Eden Massey, do you have I know we have a list, but how can patients best access this information?
So I can try and field that. So basically, within our OB clinic, we have our social workers and our psychiatrists, and we do not have any psychologists who specifically focus on working with perinatal women, specifically like CBT or otherwise. However, we do have a list of perinatal therapists in the San Francisco and Greater Bay Area who work with women. And then we'll put this in the FAQs too, but there is an incredible resource called Postpartum Support International. The website is just postpartum.net. And they are, as their name would imply, an international organization with local area coordinators who can connect you to resources within your community. So your providers at UCSF would have lists of folks, and Postpartum Support International's local area coordinator could help you connect with somebody.
Okay. One of our attendees asked, I'd like to know where the COVID-19 patients are treated at UCSF specifically. Are they mostly on Parnassus campus, Mission Bay Emergency? I have an appointment for a second trimester ultrasound at 1825 4th Street, but I'm worried about going to the building. Dr. Eden Massey, I was going to talk about this a little bit, but tell us about the screening process that everyone's going through when they enter the buildings. And
I can talk about that. And I can say that, like, I'm the mom of like 2 young kids, and my wife has asthma, and I was actually really scared to come work too. And I have been very reassured by the screening process. Just to specifically address the question, the majority of patients who have COVID-19 are over at Parnassus. The only folks who would be here would be pregnant women. We do not currently have anybody hospitalized with coronavirus who is an obstetric patient at Mission Bay. The university has a very robust screening process at the front, and no one is allowed to enter the building and go to the ultrasound unit or anywhere other than the respiratory screening clinic if they have a positive screen. So I personally feel very safe. I am a very anxious person, and I have been reassured by this process, and I hope that provides you with some reassurance. I think it is very safe to come and get your ultrasound.
I agree. And we talked about this a little bit last week. So for whoever posted this question, please visit the FAQs from the last week's webinar, where we've talked about how we've tried to ensure that we limit the possible exposures by having telehealth and in-person visits, how to decide when you should come in. Your ultrasound would be a very good reason for us to come in. We're giving all of our patients masks, and everyone, healthcare workers and patients who are coming into the building are being screened, are receiving masks. Everyone is taking, I think, if anything, I've been incredibly impressed and reassured. Dr. Eden Massey's wearing one, but just not when she's not speaking to anyone else. Reassured by the steps that UCSF is taking to make this to take this seriously. We have treated 2 patients in the past on our labor and delivery, but and those patients have done really well. So we're very, very happy with how San Francisco and UCSF has been able to address this. Another patient asked, can you talk about stress and anxiety for healthcare workers who are pregnant? Dr. Kumar, I'm sure you get this question a lot.
Yeah, it's actually a passion of mine and part of my job right now to help support healthcare workers. So I can tell you a couple of things. I'm going to refer you back to that website again, because there's a number of sections there specifically designed to support healthcare workers. And then there's apps that are available for free for healthcare workers. In the next week, the Department of Psychiatry is launching a program for coping and emotional resilience for UCSF employees. I don't know if the question is coming from UCSF employee, but there's still going to be additional resources available on webinar series for healthcare workers, as well as they're launching a video library with some video shorts that include a number of tools aimed at supporting providers. So I think those are some good tools. The main thing that I tell providers is put on your oxygen mask first. You've got to take care of yourself so that you can take care of others.
That's great advice. And for healthcare providers who are pregnant, we do have a question that we answered in our FAQs from last week. Will there be any restrictions on pregnant patients working in healthcare during this time? So I'd encourage you to look at the FAQs to get the detailed response for that. And then I think we have 2 more questions, and then we're going to end the panel to respect everyone's time. How should we approach when the partner is the one who has stress or anxiety? Dr. Kumar, what would you say to that, or Melissa?
Do you want to go first, Melissa? I can go first if you like.
No, it's okay. I think, the way that you would approach anybody, how are you doing? And also, I think what gets really sticky for all of us is we might feel very well intended with our offer to our partner, and we really have to let go of the way that that information lands with our partner and not take it personally. It's not, if I offer something to my partner and my partner is not in a place to receive it the way I intended it, that's not anybody's fault. It just, it is what it is. But I would make sure that people know that everybody is stressed right now, and that the practice of compassion is really important for ourselves and one another. And so speaking from the I statements and from a place of concern, I'm concerned for you. I would like to help you. How can I help? And then allowing the other person to have their response and their experience. Sometimes the hardest thing is knowing that our partner is suffering and we can't help, or knowing that they're suffering and there's not much we can do to change their situation, but continuing that open line of communication and also making sure we're not becoming a punching bag. Yeah.
Yeah, I appreciate everything that you said, and I feel like this is a good balance to that. So I generally think it's important to have humility and remember that as difficult the people in our lives might be behaving or dealing with the stress, stress looks different with everybody. And there's a good chance that we might be pressing buttons with those around us in ways that we're not aware. And so I think, making sure that we are being really thoughtful of our own wellness, make sure that we're okay. It also helps us to tolerate the distress better in others. And also, if we're practicing good wellness skills, we can invite people into those things. So I know families who have never or even dreamed of doing things like meditation together and now do nightly headspace. So, not to say that that is the ideal in any way, but just you'd be surprised as you try out things to invite people into that. And then back to what we've said before, if your partner's stress is actually making you feel physically or emotionally unsafe, to reach out and get help.
Thank you. And the last question before we end, and just a reminder to everyone, we will be sending you an evaluation and would love to hear your thoughts about what we can do better or what really resonated with you, so that we can keep that in mind for the future. Someone asked, if things are going well in the community for a while, at what point will we be allowed to have a doula join us during delivery? And I'm going to take that question and just remind you all that our policies are changing very frequently on labor and delivery in the outpatient setting. For now, we still have the one support person policy, and I promise you we will be updating as soon as we start getting more information and know what direction the city is taking and the Department of Health. We will be letting our patients know if we're changing, if we're making any updates to our visitor policy. We also, again, I would refer you back to the Q&A from last week and know that our doulas have gotten really creative in the community and have found ways to virtually support patients, which has been really incredible to see. So please know that as we get more information, we will let you know when we make that change. And on that note, I just want to thank everyone for your time today, for your flexibility, for joining us. We are going to continue this series next week and focus more on gynecologic care at UCSF and how our patients are going to be affected and how we'll be addressing their needs. Thank you so much for your time today, to our panelists, to our interpreters, to our attendees. We feel so grateful for to be able to have this format to reach you all. And I want to thank especially Brooke Peterson, Bertina Lee, and Bernadine Tortelli for helping us put this session together. Have a good day, everyone.
Thank you.